One of the messages that I trust that you received is that most people who major in psychology aren't going to go on to study psychology. They're going to use those skills, that approach to succeed in other careers. The psychology major gives you strength in understanding information, and presenting information, analyzing information, and communicating information. And that is applicable to a wide range of careers. I know that many students come to psychology because they're interested in a career involved with counseling, clinical psychology, and that is why we are very fortunate to have Dr. Robert Deluty here to talk with you, to share his expertise. Dr. Deluty has many roles at UMBC, and he does them all very well. Dr. Deluty is a longtime member of the psychology department. He is now Associate Dean of the Graduate School. He is the former Director of Clinical Training in the psychology department, so he brings a wealth of experience from that. And he currently teaches a very popular course called Introduction to Clinical Psychology and Psychotherapy. And so with that, I'd like to let Dr. Robert Deluty take the stage.
Thank you, Dr. Robert. My pleasure. It always is my pleasure to be here. Folks, I've been teaching here now for 32 years, just a little while longer than Dr. Warwick. Actually, she was, I think, in first grade when I started here. And it is so often the case that students, when they come to see me for advisement, will say, I want to help people ultimately. That's what I want to do with my career, with my life. What sort of doctoral program, what sort of graduate program should I pursue? What I first say to students is, all right, if you want to help people, if that is your goal, to help, let's say, emotionally troubled, behaviorally disturbed individuals, let's say that is your goal. Why do you want to embark? Because often students will say, what sort of doctoral program, PhD program should I pursue? And the first thing I ask is, why a doctoral program? Now, when I speak of a doctoral program, it's one piece of chalk, we're typically, when we talk about clinical psychology, talking about either a PhD program or a PsyD program. The PhD stands for Doctor of Philosophy. PhD programs are research-oriented programs. Indeed, the PhD is a research degree. In contrast, the PsyD program also is a doctoral program, but it gives you a Doctor of Psychology degree. PhD programs in clinical psychology operate under what is called the scientist-practitioner model of training. Scientist-practitioner. It is sometimes referred to as the Boulder, named after Boulder, Colorado. The Boulder model of training, scientist practitioner. And the emphasis is on scientists. There's a reason that scientist is put first. The belief here is that since it is a research degree, primarily students going through such a program should be researchers, should be scientists, should be able to conduct their own research and to be excellent consumers of other people's research. But because it is a clinical psychology program, emphasis, of course, has to be placed as well on the practice. And by practice, we're talking about skills in terms of assessment, interviewing, consultation, and of course, therapy. Right? PsyD programs are extraordinarily varied. Sometimes I have heard Dr. Warwick and I have colleagues who, when they hear somebody's interested in a PsyD program, they may roll their eyes. Because unfortunately, some PsyD programs do not have very good reputations. On the other hand, there are some PsyD programs that are superb. And in a heartbeat, I would recommend an excellent student to go into such a program. It depends what type of PsyD you're interested in. Let me describe briefly two major types of PsyD programs. And I will also point out to you which ones I would recommend more than the other. One type of PsyD program basically reverses the emphasis of scientist-practitioner, and the model of training is practitioner/scientist. In such programs, both the practice of psychology and the science of psychology are highly valued. There generally, however, in such programs is more emphasis placed on practice than science. So in such PsyD programs, it is unusual that a doctoral dissertation, an original piece of research, is asked of the students as basically the capstone of their experience in their program. Students, however, in such practitioner scientist programs will be expected to take courses in data analytic procedures, in research methods, so at the very least, they will be good consumers of other people's research. They will be able to open up a journal, for example, read an article, and be able to differentiate a worthy piece of research from a piece of research that is not well done, right? Practitioner scientist programs are often housed within departments of psychology. So I regard the best PsyD programs out there, the ones that do the best job in terms of training practitioners as well as scientists, typically are going to be found in departments of psychology at accredited universities. And some examples of these would be Rutgers in New Jersey, Baylor in Texas. And I think a good program, not quite in the league of Rutgers or Baylor, but a really good local program that offers a PsyD is Loyola in Baltimore. Offers a PsyD program that operates under the practitioner scientist model of training. Right? There are other PsyD programs, however, that I do not in general think as highly of. And these are PsyD programs that operate under what can be called the practitioner-scholar model of training. So again, practitioner-scholar versus practitioner-scientist. Practitioner-scholar programs are much more likely to be found in what are called freestanding professional schools of psychology. So such things as the California Professional School of Psychology. You may have heard in Northern Virginia there is a professional school called Argosy. These programs do not really give, in my mind, enough attention to the science of clinical psychology. That is why I think it is reasonable for them to call themselves practitioner-scholar programs. There are often very little, if any, courses offered in research methods and data analytic procedures. Students who come out of such programs generally are not particularly good consumers of other people's research. And I see this as a detriment to the clinical work they would ultimately do. Because unless you stay abreast of other people's research, people who come out of such programs generally do not do any research themselves once they leave their programs. But because they are not particularly good at understanding other people's research, it seems to me this will have an impact on their growth as clinicians. Because if you want to know, okay, what are the state-of-the-art techniques that are now being used in dealing with, let's say, obsessive-compulsive disorder in children? Or what are the latest advances in terms of intellectual assessment or neuropsychological assessment that requires that you be able to pick up a journal article and be able to make sense of it? To see, for example, whether this new tool that everybody is talking about is worthy. Is it reliable? Is it valid? If you don't understand basic concepts of reliability, validity, know a good piece of research from a shoddy piece of research, you're not going to be able to really grow as a clinician and keep up with the latest advances. I regret that many practitioner-scholar programs do not give you enough in the way of research training in order for you to become a good consumer of other people's research. So if you do decide to go in the PsyD direction because your interests are overwhelmingly in the area of practice, you don't see yourself getting a job as an academic psychologist, you don't see yourself working full-time as a researcher at NIH, you see yourself as a full-time practitioner, but nonetheless you do want to get some good basic research training, then I would go with the PsyD program. Okay. Any idea about how many years it would take to get a PhD on average in a PhD program in clinical psychology? Just as sort of a rough guess.
7 or 6?
7 years. Excellent. That's a hell of a long time in terms of full-time study. You might say, 7 years? How in the world? What are you doing for 7 years? In clinical psychology doctoral programs, and now I'm going to focus in particular now on PhD programs. Clinical psychology PhD programs generally involve 3 to 4 years full-time of coursework. But while you are doing your coursework, you're also getting clinical experience while you're also conducting research. So you're working on your master's thesis along the way to your PhD, while you are taking 3 or 4 courses a semester, often while you are serving as an assistant, be it a teaching assistant, a research assistant, and typically starting in your second year, you're going to do what are called externships. Now, at UMBC, one could do, at the 300 level, we offer applied psychology internship. The term internship, when we're talking about an undergraduate's work, is different than what we talk about in terms of internship in clinical psychology graduate programs. And I will get to internships in just a moment. Before one does an internship in clinical psychology, typically one does 3 to 4 years of externships. What do externships involve? They involve clinical placements. They involve, for example, many of our students in their second year will start working in a hospital, let's say Springfield Hospital, Shepherd Pratt Hospital, Spring Grove Hospital. They may work at a mental health clinic. They might work at Mount Washington Pediatric Hospital. They are typically working, externships are typically 10 to 15 hours a week. 10 to 15 hours a week, the student is working in some sort of clinical setting, providing assessment and or some sort of therapy or counseling for a variety of clinical populations. Generally, in the second year, students are doing externships. Second year of study, they're doing an externship. They do an externship typically in their third year and fourth year. And it is often the case after 3 years of externship that students will start applying for internships. Again, the notion of internship in clinical psychology is different than applied psychology internship for an undergraduate. Internships in clinical psychology are full-time. Basically, you're talking about full-time, at minimum, 40 hours a week jobs. Basically, you become a staff member in the facility where you're doing your internship. And internships in clinical psychology are nationally competitive. APA accredited, and by APA I mean American Psychological Association. The American Psychological Association accredits a select number of internships. It is expected that APA-approved clinical psych programs will send their students to APA-accredited internships. Students from all around the country, PhD programs, PsyD programs, are applying for a limited number of APA-accredited internships. It's tough. It's very competitive. So therefore, for 18 years, I served as director of the clinical psychology doctoral program here. It was terribly important that our students, in order to be competitive for internships, get excellent externship training so they could compete well against people from around the country for these highly selective internships. Right? So, we're talking typically 3 to 4 years of academic work, courses. And the courses are not just in clinical psychology, because a PhD in clinical psychology assumes that the student will also be very knowledgeable in a wide variety of domains within psychology. Biological bases of behavior, personality, social, developmental psychology, and of course, research methods, data analytic procedures, as well as courses in psychopathology, psychological assessment, psychological intervention. It's a lot of coursework. So we're talking 3 to 4 years of coursework. We're talking about 3 years of externship before you go on the full year internship. We're talking research requirements, typically including a master's thesis and a doctoral dissertation. That's a lot. Not to mention, many students, in order to support themselves, are on research assistantships or teaching assistantships. How many of you have had, for example, a graduate student serve as a TA for you? And if you haven't yet, you will if you take 331 and 332, all right? Which brings up an interesting issue with regard to PsyD programs. PsyD programs, especially the PsyD programs that offer the practitioner scholar model of training, those that are housed within the freestanding institutes, like the California or the Illinois Professional School of Psychology, they do not offer assistantships to their students. Why? Why do you imagine they would not? Any ideas?
Your standards may be lower?
No, that's actually not the issue. The issue is, what are the major types of assistantships offered to graduate students? They tend to be two, either a teaching assistantship or a research assistantship. Why are no teaching assistantships offered in such PsyD programs? There are no undergraduates. Graduate students typically will serve as TAs for undergraduate classes. In such institutes, there are no undergraduates. So you can't serve as a TA for like 331 to 332 intro psych. Why are there no research assistantships in such institutes? Faculty are not doing research. There is no grant support for RAs. So generally in PsyD programs, especially PsyD programs in the freestanding institutes, you have to pay your own way, which makes it very difficult if you are, let's say, engaged in some sort of full-time employment outside of the institute or university while you are pursuing these requirements. It makes it very, very tough. In addition, folks, for those of you who are interested in PsyD programs, I would urge you to do a lot of research before you apply. And what's wonderful these days for both PhD and PsyD programs, basically everything is on the graduate school websites of the particular universities. So if you're interested in, well, I'm interested in, let's say, PsyD programs, good ones, really good PsyD programs, let's say, that operate under the practitioner scientist model, how do I know what is out there? Google searches, if you just type in, for example, APA accredited PsyD programs, you'll get a plethora of information that comes out. Then look up each one of these sites. Find out, for example, at this particular university, in this particular program, what are the faculty doing? What are the faculty doing in the way of research? What sort of clinical opportunities exist within the community? What sort of externships are students doing? What sort of internships are students getting? And very importantly, what sort of jobs are the graduates of the program getting? Okay, terribly important. With regard to PhD programs, get back to PsyD for just a second. One of the things I would be sure to look up if you're interested in a particular PsyD program is how many students do they admit per entering class. For PhD programs, generally we're talking about an entering class of about 8 to 12. I know of PsyD programs, particularly the freestanding institutes, who have entering classes of 40 to 50. I would avoid those programs like the plague. Because with such a large entering class, you know you're not going to get the concerted amount of supervision time, the amount of time you really need to flourish as a clinician, as opposed to a program that has, let's say, an entering class of about 8 or 9. So imagine 40 or 50 entering students, none of whom are supported, with a faculty that basically they have full-time jobs outside of the institute, they do their clinical work, they pop in, teach a class, and that's basically the last you see of them. That is not exactly the sort of graduate program that I would recommend a student pursue. Right. So again, be very, very cautious in terms of the programs that you apply to. How long does it take students in general to get through? Now, on average, it's about 7 years of full-time study. There are some freestanding professional schools because students have to support themselves. That slows their progress. You may be talking about the 8, 9, 10-year plan. Is that something that you want to pursue? Right. Not to mention the nature of the training that you get. With regard to PhD programs, you have to ask yourself, is this really what I'm looking for? A program that emphasizes the clinical science within the helping field, as well as will give me the basic training I need in order to get an internship and to do clinical work independently down the road. Let's say you do decide, yes, the PhD is what I want to pursue. It is critical that you start the research enterprise by doing research about the different programs. If, for example, you were interested in UMBC's clinical psychology doctoral program, I would urge you to go to our website, look up which of the faculty are associated with the PhD program, what sort of research are they doing. Because what we require, and this is the case of the great majority of PhD programs out there in clinical psych, they will ask on the application, with whom would you like to work? Whose research interests are most comparable to yours? What are your research interests? Now, you're not going to be expected when you're applying to graduate school to really lay out your dissertation ideas. But you are expected to give at least some idea to the admissions committee of what sort of things you would like to pursue. I'm interested in the area of addictions. I'm interested in the area of eating disorders. I'm interested in the area of domestic violence. And therefore, I would like to work with Dr. Murphy. Eating disorders, I'd like to work with Dr. Warwick. Addictions, I'd like to work with Dr. DiClemente. Pediatric pain, I'd like to work with Dr. Dahlquist. What you are typically going to be asked to do is to describe what your research interests are, what your clinical interests are, and whom on the faculty you would like to have as a mentor, right? Which means that you've got to do some homework. You've got to find out what sort of research are the faculty doing, and read up on their research, okay? So I don't want you to do this casually. You've got to give it a lot of thought. Because if you say, I want to work with Dr. So-and-so because I'm very interested in this line of research or that line of research, before saying that, I would urge you to look at some articles, recent articles, chapters, books that the particular faculty have worked on, right? You want to be a knowledgeable consumer. With PhD programs, it is critical that there be a really good match between what you're looking for in a program, both in terms of clinical and research training and with what they have to offer. You cannot lie, or you cannot shade the truth. If, let us say, you want to be a full-time practitioner, don't say on your application, I very much want to do research when I leave the program, and I'm looking for a job in academia, when that is not true. Because you're not going to likely be very happy in such a program. If you're interested in being a full-time practitioner, you don't intend to do another piece of research once you leave your graduate program, you want to be a good consumer of it, but not to do original research yourself, then be strict with the clinical faculty to whom you're applying to those programs. And again, think more in terms of PsyD as opposed to PhD programs. We'll get back to admissions criteria in just a moment, but for PhD versus PsyD. But let me talk about two other issues before I return to PhD programs, and that is MA versus MS programs, Master of Arts and Master of Science programs in clinical psychology. Let me point out that the terminal degree for independent practice as a psychologist is the doctorate. If you want to practice independently as a clinical psychologist, as a licensed psychologist, you need the doctorate. So, if, let us say, the terminal degree for independent practice is the doctorate, why would one want to pursue a Master of Arts or a Master of Science in clinical psychology if you can practice independently with a master's? Why would you bother going for such a degree?
It takes less time.
Yeah, it does take less time, but why would you want to take, if time is of the issue, don't go to any graduate program, that'll take you no time. But why would one go for a master's? What would it buy you to go for a master's in clinical psychology? Yes?
It would increase your opportunities of getting to work with others in the future.
Excellent. Let us say it is the case that when you were an undergraduate, you were somewhat, let's say, of a slacker in your freshman year. Or you were sort of lost and you weren't sure what you were going to do with yourself. So your early grades, let's say in your freshman, and let's say even these first semester of your sophomore year, were nothing to write home to mother about. And even when you began to show some interest in psychology, let's say in the second semester of your second year, you really didn't give it your all and only got a C in intro. You really began to hit your stride starting in your junior year. Nothing but A's and B's. But now, it is the beginning of your senior year and you're thinking of applying to graduate programs, let's say doctoral programs in clinical psychology. Let's say your overall GPA is about a 3, your psych GPA is about a 3.2. You are simply not competitive at this point for a PhD program, which are extremely competitive. What you might decide to do is go for a Master of Arts or Master of Science degree in clinical psychology. In a sense, this is a stepping stone. It's an intermediary step between the undergraduate degree and the PhD program. You're not competitive right now based on your undergraduate work. However, if you excel in your master's program, do basically A-level work in your master's, but beyond the coursework, really impress your faculty in terms of, for example, your clinical experience, the clinical expertise that you're showing in terms of psychological assessment and intervention. and especially in programs where it is required that you do a thesis, a master's thesis, as a degree requirement, you could really impress the faculty who will then write on your behalf. They could say to, let's say, prospective doctoral programs, this student, although he did not really show how talented he is as an undergraduate, has amply demonstrated his abilities both as a clinician and as a researcher in our master's program. His master's thesis is one of the tops I've seen in my 20 years here. He has done A-level work in his courses. That sort of experience, those sorts of letters of recommendation will do you a world of good if you're looking to pursue doctoral study. I should also note that in the state of Maryland and in some other states in the country, but we'll focus just on Maryland, there is a particular status. The status is called Psychology Associate. The Psychology Associate status is granted by something called the Maryland Board of Examiners. Okay? The Maryland Board of Examiners of Psychologists determines who is license eligible to become a licensed psychologist, as well as who is eligible to become a psychology associate in the state of Maryland. And what is a psychology associate? A psychology associate has a master's in psychology. Typically it's going to be in clinical or counseling psychology. They have a master's degree, and they wish to work under the direct supervision of a licensed psychologist with a psychology associate status, which, as I mentioned, comes from having a master's, plus having the support of a licensed psychologist who's willing to provide direct supervision for you. With psychology associate status, you can do assessment, you can do interventions, therapy, counseling, you can do consultation. However, it must be under the supervision of the licensed psychologist. You cannot work independently. But for some individuals, that's fine. They're not interested necessarily in working independently. They have no problem doing the assessment, doing the consultation, doing their interventions under the supervision of a licensed psychologist. Of course, they're not going to make nearly as much as the independent licensed practitioner, but if, let us say, money is not that big an issue for them, the amount of money they would make as a psychology associate is more than enough for them. Let's say they only want a part-time position as a psych associate because they're raising a family at the time. This may work out very well. Yes?
So how much, like, I guess, what is the supervision really like? I mean,
Pardon me?
like how much supervision?
We're typically talking about approximately 1 hour of supervision for about every 3 to 4 hours of client contact. Okay. Good question. All right. So, Master of Arts, Master of Science programs, again, do research on them. Find out how many of the graduates of such programs go on to PhD programs. How many of the graduates of such programs are able to serve as psychology associates and actually practice psychology? Okay? This sort of research is critical for you to make an informed decision, a good decision in terms of what's the right sort of program for you. All right. With regard to PhD programs, let me mention something quickly because it's an issue that often comes up. Students will sometimes come to me and will say, what's the difference between counseling psychology and clinical psychology? Because, you know, I went to our counseling center and I know that the person I was seeing has a PhD in counseling psych. Is there a difference between counseling psych and clinical psych? What is that difference? Any ideas? Any ideas what the difference is? Let me describe to you. Counseling psychologists tend to work with either mildly or moderately troubled, disturbed, dysfunctional individuals, or with people who do not have a psychiatric or psychological problem. So what sort of person without any sort of psychological or psychiatric diagnosis might seek out a counseling psychologist? Any ideas?
Something with everyday problems, like relationship issues.
Excellent, splendid. There's not a psychopathology there, but let's say you're having a really hard time with your girlfriend right now, or your boyfriend. You're not sure how to communicate, you feel that this is yet another relationship going south, you want some advice in terms of how to make it work. We're not talking about psychopathology here, we're not talking about, you know, severe depression or panic attacks. No, we're talking about, in a sense, what can be called the problems of living. That might be one reason to go see a counseling psychologist. Another might be if you're seeking vocational or guidance counseling, career counseling. Counseling psychologists can be enormously helpful in terms of vocational counseling, giving you some sense of, for example, given your particular interests, given your particular values, this would be the direction I would recommend you pursue in terms of a job or a career. That's not dealing with psychopathology, but it's a different type of counseling. However, counseling psychologists, for example, those at university or college counseling centers, often will deal with, let's say, relatively mild anxiety, relatively mild depressive disorders. They might deal with, for example, problems in terms of studying, procrastination. Right? They might deal with, for example, how to manage the impulsivity. Let's say you have attention deficit hyperactivity disorder, you find yourself terribly impulsive, therefore finding difficulty concentrating on particular material. Counseling psychologists might be very helpful in that regard. Right? It is the case, however, that when you come to clinical psychology programs, you're typically dealing with a broader range of pathology and often a more severe type of psychopathology. So in clinical psychology programs, it is basically always the case that at least in your coursework, if not also in your externships and internships, you'll be exposed to a wide range of pathology, from relatively mild pathologies, relatively mild anxiety or depressive disorders, to the most severe types of psychopathology, schizophrenia, for example. Okay? And the testing and interviewing experiences that you get in clinical versus counseling psychology is going to be very different. Counseling psychology programs will give you exposure not only to tools that are used to judge or assess relatively mild anxiety or depression, like the Stage 2 Anxiety Inventory, Beck Depression Inventory, but also vocational inventories. Okay? In contrast, in clinical psychology programs, you will be exposed to projective tests, Rorschach TAT. You will be exposed to a wide variety of personality inventories. You will be exposed to neuropsychological assessment. You will be exposed to a far greater range of assessment tools, and assessment tools that go beyond the relatively mild pathologies all the way to very severe psychopathologies. Let's talk now about the application process. I'm now teaching Intro to Clinical Psych, and it may well be the case that I'll be seeing some of you in that course down the road. And what I always do in my first class in Intro to Clinical is we go around the room and I have students talk about, first introduce themselves, and say what they plan to do when they leave here, leave UMBC. And it is typically the case that I will get about a half to at least, well, let me rephrase that. I will get 2/3 to it, or down to at least 1/2 of the students will say they're interested in pursuing some sort of graduate study in psychology, especially clinical psychology. So it's very likely that this might be relevant for you folks down the road. If you're interested in pursuing an MA, an MS, a PhD, or a PsyD in clinical psych. GREs are very important. GREs stand for the Graduate Record Examination. Graduate Record Examination is somewhat akin to the SATs. There is a general test for the GREs, and there is a subject test, which zeroes in just on psychology. I do not know of a PhD program that does not require both. They require you to take the general exam, the general GRE exam, as well as the subject test in psychology. Do you have to prepare for this? I would urge you to do so. There are study guides. I looked the other day, actually, I just typed it in a Google search, GRE, general exam, and it's amazing the amount of information you get about it, including some sample tests. It's great. If you then decide, for example, to take a course, be it a Kaplan course or some other prep course, for many students this can be invaluable, especially for those students who don't do particularly well on standardized exams. So if, let's say, you didn't do very well on your SATs and don't think that likely you'll do appreciably better on your own, then you might consider either reading up, doing some self-help in terms of study guides, or taking a course. At the very least, check out via Google, just in terms of what is the nature of the verbal section, the quantitative section, the writing section. There is now a writing section, an analytic writing section. Check them out and see what they're all about, okay? In addition, the psychology subject test is required. I do not know of a PhD program that does not require it. PsyD programs, some do, some don't. But PhD programs, I don't know of one that doesn't. How do you prepare for the subject test? Well, again, what I did was not too long ago, I typed in a GRE psychology subject test, and again, you get remarkable amounts of information right there on the website. And it's not word of mouth, it comes directly from the Educational Testing Service, who write the GRE exam. ETS, the Educational Testing Service, will give you a sample exam. They'll tell you about the breakdown of a typical test in terms of how many questions can you expect in terms of clinical psych or personality, how much can you expect in terms of research methods or data analytic procedures, how much should you expect in terms of developmental abnormal behavior, biological basic behavior in general. Very, very helpful. I recommend that students get practice guides, and the practice guides for the subject test in psychology typically will have practice exams. This is very, very beneficial. What you do is you set a timer at your desk, you make believe that you're actually taking the exam. So you get a feel for how many questions, in a particular amount of time, a lot of amount of time. So you can get in the habit of, yeah, I can nail this, I can handle this. The more practice you have in taking these practice exams, likely this will help your performance. And when you find out, for example, yeah, I did particularly well in the questions in clinical, personality, abnormal, but I didn't do so well in terms of the biological bases, sensation perception stuff, physiological psych stuff. I really have to bone up on those areas, okay? And that sort of information you'll be able to get by seeing how well or how poorly you did on certain parts of the test. I recommend that students, in preparing for the psychology subject test of the GRE, reread, cover to cover their intro psych text. If you took intro psych within, let's say, 4 or 5 years, that's fine, okay? If, however, it's been many years since you took intro psych, I'd go to our bookstore or library and get a more modern copy of a reputable intro psych text, something that's being used by our faculty right now, okay? Because the level of detail, generally intro psych text will have a chapter on sensation perception, a chapter on theories of personality, a chapter on psychopathology, a chapter on social psych. It's that level of detail that typically is being tapped in the GRE subject test. Okay? So the combination of practice exams and going over, again, cover to cover good intro psych test generally will prepare you well. GPA matters. Your overall GPA and your GPA in psychology. Your GPA, especially in your last 2 years, will be given greater weight than your GPA, for example, in your first semester or your first year. Right? Now, some students think that, okay, I therefore, because I know I want to go on to graduate school, I'll be extremely selective in terms of my course selection. I'll basically, I'll do the minimum requirements in terms of general education requirements, and then I will take those courses that are either directly in psychology, that is, they are psych courses, or extremely related to psychology. Perhaps, sociology courses that, are relevant to psychology, social work classes, etc. All right? And let us say you're particularly good at these courses. You might think, well, the high GPA, that'll be great. That'll really impress the admissions committees. Not necessarily. Narrowness of focus is not going to necessarily be impressive to an admissions committee. Indeed, although there are, of course, differences from member to member, faculty member to faculty member in terms of admissions committee, what they're looking for, most faculty that I know, when they're going over applications, are going to be much more impressed with somebody who's taken a broad view of undergraduate education. They haven't just limited themselves to, okay, bare minimum requirements to fill out my general breadth requirements, and then I'm just zeroing in on everything I can in psychology, social work, sociology, etc. I would be much more impressed with a student who took philosophy classes, literature classes, physics, biology, who stretched themselves, because when you're applying to graduate programs, it's not just high GPA that people are interested in. They're interested in what kind of a scholar is this person who's applying to the program. How much have they gone outside their comfort zone? I see that they've taken not only, enough to fulfill the general education requirements, but they took physics too. They took organic chem. They took, for example, a philosophy of ethics class. I mean, they have gone above and beyond what was simply required of the general distribution requirements to really stretch, to grow as a human being. That would be very impressive to me. Let us say there is a mismatch between the GREs and GPA. That is, in terms of your GPA, you've done really well. Let's say your overall GPA is about a 3.5, your psych GPA is, let's say, 3.65, but you took the GRE general exam and you bombed the verbal portion. And by bombed, let's say you've got your score fell at the 15th percentile. What do I mean by 15th percentile? Anyone? Yes.
Did better than 15% of all the students.
Excellent. Of the people who took the test. That means that 85% of the people who took the test did it better than you. 15th percentile, again, not so good. Yeah, that's putting it mildly. It's not good. And it really is going to hurt your chances by itself, in and of itself. But as I mentioned, let us say your overall GPA, excellent. Your psych GPA, even better. You feel you can get strong letters of recommendation, which I'll get to shortly. What do you do about that very low verbal GRE, which fell in the 15th percentile? What do you think you would do? Yes?
Try to redeem yourself by scoring higher in other classes overall.
One thing you could do, and I'll get to that in just a moment, is certainly take the test over again. And, of course, prepare better this time. One hopes that with better preparation you might be able to increase the score. But using other aspects or other parts of your dossier to compensate for the weak performance on the verbal GRE. And how might I recommend you take care of it? Let us say, indeed, 15% on the verbal GRE. However, let us say you received A's in writing intensive classes, not only in psychology, but in some other disciplines as well. That's what I would address in your cover letter or in your personal statement. You might say, for example, and the mistake that a number of students make is they feel, if I don't talk about the low GRE, no one will notice. We will notice. There's no way to get around it. We are going to notice. So address it up front. And you can say, non-defensively, I was disappointed in my performance on the verbal portion of the GRE. I do not believe that this adequately reflects my verbal abilities. I believe a far better reflection of my verbal abilities or verbal talents, or verbal skills, may be found in the A's I received in the following courses, all of which were writing intensive. That's a great way to compensate poor performance on one test. With regard to the quantitative score, let us say your quantitative GRE score fell at the 20th percentile. Again, this is weak if you're applying to graduate programs, which are so super competitive. What do? What in your record can compensate for a low quantitative GRE score? How did you do in 331, 332? Did you take a calculus class? Did you take statistics classes? How did you do in quantitatively oriented courses? If you received A's in those courses, that is a wonderful counterpoint to, let us say, relatively poor performance on the GRE exam, which is just a single exam. If you have, let's say, 4 A's across 331, 332, and a couple of math classes, that would lead me to feel quite comfortable that you could handle, for example, grad statistics. Letters of recommendation are enormously important. Enormously important. Generally, you're going to be asked for 3 letters of recommendation for, let's say, a clinical psychology doctoral program. I would advise you to have no less, if you're asked for 3, no less than 2 coming from academic psychologists. Psychologists working in an academic setting, university professors, for example. You might, for example, decide to go with 2 psychologists in academia and a 3rd psychologist who works, let us say, at NIH or or Maryland Psychiatric Research Center, someone under whom you've done research. Okay? But I would generally recommend no fewer than 2 of the 3 should be from academic psychologists with PhDs. Why would this be so important to go with academic psychologists if you're going for a PhD program? Why not a neighbor? Why not a friend?
Well, we take classes.
They're not able to assess your ability.
Splendid. people with PhDs, particularly PhDs, for example, in relevant fields like clinical psychology, who've done work in this field, know intimately well about what is required of a student going into such a program. They are very informed to say, yes, they will write their name PhD, professor of psychology, associate professor of psychology. Obviously, they know what it takes to get a PhD, and they are saying, you've got what it takes to get it. That's impressive. As opposed to, for example, you could get let's say, a wonderful letter from a licensed certified social worker under whom you worked at a particular hospital. Licensed certified social workers really don't know what it takes to get a PhD. I mean, they might have heard about it from a colleague or friend, but they themselves did not go through it. Letters of recommendation from PhDs are saying, you're applying for a PhD program. They got their PhD. They know what it takes. They feel you've got what it takes. Right? They also know your work best. Okay? Generally, the academic psychologists from whom you want to get letters of recommendation, I would recommend should not be from professors, let's say, in whose large lecture class, let's say Psych 100 class, you got an A. But let us say you never spoke up in class. You did extremely well on every quiz or every test. But the professor really can say remarkably little about you. This happens to me sometimes. I will have had a student, and generally when I teach Psych 345, I have about 65, 70 students. Let's say a student who never said a word in class comes up to see me and asks me to write a letter of recommendation. I never heard her voice, and never saw her during office hours. She did indeed, I checked the record, she got an A on each of the 4 exams and got an A on the paper that she wrote, the major paper that she wrote. What can I say? Generally, first paragraph I describe the course. Second paragraph I describe how well she did in the course. And then I will look at the rest of her, let's say, transcript, and I will say the splendid work she did in my course is matched by the excellent work she did in such demanding courses as sensation perception, physiological psych, advanced behavior pathology. Yes?
Isn't that all stuff that the people interviewing you could just look up anyway?
They could. They could.
So it would render the letter of recommendation kind of pointless overall.
Well, I wouldn't say pointless, but it doesn't help you as much as a letter coming from, let us say, somebody with whom you took, let's say, 2 classes, one of which was writing intensive. Or what you took from this professor a course and you worked in their research lab for 2 semesters. Think of how rich such a letter could be. In my course, she was active, she was involved, she asked wonderful questions, she did splendidly on the exams, terrific paper, and afterwards I was delighted and honored that she chose to work with me on my research. Worked with her for 2 semesters. Remarkably reliable. She became a member of our research team immediately. She was making excellent suggestions in terms of graduate student proposals. She was an active, valued member of our research team from the get-go, and will be a co-author on a paper presentation later this semester. That's a hell of a letter. That's the sort of letter that will really stand out. A letter saying she received an A on each of my exams, and this suggests that she is a very bright, hard-working student, and this is matched by the A's that she got in the other courses. That's the sort of letter that you can expect from the great, great, great majority of people who apply to graduate programs. And I should note, folks, when I talk about competitive, let us say you've got a clinical program where 100 people are applying. They may only accept 8 to 10 students. So you've really got to set yourself apart. You set yourself apart by the research experience that you get, the clinical experience you can get. And what is wonderful here at UMBC is the opportunity to do applied psychology internships. We can get some clinical experience in the field. Sometimes it's done through the Shriver Center. Sometimes it is done, you yourself learn that there is a volunteer position at Springfield Hospital, at Shepherd Pratt Hospital, working, let's say, in a day hospital unit. Let's say at Shepherd Pratt, there are children, inpatient children, who are there, they sleep there, they're living there because of the severity of their psychopathology. And on weekends, there isn't a hell of a lot for the kids to do because the staff, it's basically a skeletal staff. There are typically no psychiatrists there except, on call in case of emergency. Wouldn't it be wonderful if, let's say, you could spend some time just, spending time with the children, monitoring their activities, perhaps participating as a therapy aid in some way. You're seeing up close what psychopathology really looks like. You're gaining that sort of experience. So you get the clinical experience, serving, for example, on a suicide hotline, being a peer counselor with regard to drug addiction. You can get supervised clinical experience as an undergraduate. You most certainly can get a wealth of research experiences. That, in combination with the coursework, will serve you extremely well when you apply to doctoral programs. One very last thing. Folks, and this is something I recommend always to students who are interested in applying to graduate programs. If there is a particular faculty member under whom you'd like to work, or with whom you'd like to work, I urge you to send an email to that faculty member before you send in your application. And what would I say in the email? Dear Dr. So-and-so, I'm thinking of applying to your graduate program, and I would very much be interested in working in your lab or helping you to conduct your research or working within your field. Are you taking new students in the fall? Why is it so important to ask that question? Because, folks, there are students who send in their applications and go on and on and on about how much they desperately want to work with this particular professor. Basically, they have lived and breathed this faculty member's research their entire life, as far as they can remember, and they want to work with them, without finding out that this particular faculty member is about to retire, this faculty member is about to go to another university, this faculty member is saying that, I'm sorry, I'm completely filled up with graduate students, I can't take on anybody more. You've got to find out, it's a simple thing, and now via email, it's a matter of 2 sentences, send it, and if they write back, yes, I am interested in taking new students, if you're interested in my research, please do apply, okay? If they say no, for whatever reason, you've saved yourself a hell of a lot of work. Okay. I see that we're out of time.
Well, thank you, Robert.
It's my pleasure.
Yeah, I think we should thank Robert for sharing his expertise with us. Does anyone have any quick questions
Quick
while he's
question.
still here?
Yes?
If you're like doing a master's program,
Yes.
and decide on later, or maybe after you finish your master's program, go to your PhD, does like the program like carry on, or any of the credits like carry on to your PhD program?
Generally not very many.
So if you,
If the master's, however, is housed in the same place, in the same department, for example, Loyola. Let us say you get a Master of Arts or Master of Science at Loyola, and then want to transfer to the PsyD program, there will be a good deal of transfer. However, if you go to a different institution, there tends not to be very much transfer. One last question.
Is it a good idea to take up an internship while doing your undergrad?
Yes. An applied psychology internship? Yes. And generally by applied psychology internship, that's somewhat akin to an externship at the graduate level. We're generally talking about, let's say, about 10, 15 hours a week. But even if it's just a few hours a week, 3 hours a week, at least to get some clinical experience, very valuable.
Thank you, Robert.
My
This is-
pleasure.